Hi everybody, Dr. Eric Balcavage, and welcome back to my Natural Solutions for Thyroid website and our continuing series on hidden causes of thyroid symptoms that your doctor probably never told you about. And remember, we said these are hidden causes because typically your lab markers that your doctor's doing, the lab tests he's doing, is typically like a TSH level, maybe just to monitor your thyroid function. And this isn't enough testing to really evaluate the 24 hypothyroid patterns. And they're often using lab ranges, which we discussed on an earlier video, and lab ranges are just too wide to pick up many of these thyroid patterns. So serotonin is what we're going to talk about today. And serotonin is a neurotransmitter in the brain. And if you have decreased levels of serotonin due to stress, some form of stress, it can affect or decrease the production of TSH, or thyroid stimulating hormone. If I decrease my production of TSH, I will have less thyroid hormone being produced, and therefore I may start to have symptoms of thyroid condition, even though my lab tests look normal. TSH levels will not be suppressed outside of the lab range, but they will be below the functional range. So how do you know if serotonin's at the root of your thyroid symptoms? Well, probably you've been to your doctor and you've had your TSH level checked, and your TSH level is within normal range, so he hasn't run any other tests. And remember, he's saying it's normal within lab range. And we talked about this on another video, that lab ranges are really too wide to really evaluate the thyroid gland appropriately to find all the 24 plus hypothyroid patterns that are causing people problems. So TSH is inside lab range, but it will be below the functional range, okay, of 1.8. You're probably going to have symptoms of depression, anxiety, symptoms you may associate with PMS. You may have sleeping problems. You may have cravings for carbohydrates. These are all indications that your serotonin levels may be low. If you have those symptoms and you have hypothyroid symptoms and your TSH level is within lab range, this may be the cause. So what's causing your serotonin levels to be off? Well, probably some form of stress, whether it's emotional stress, whether it's stress created because you have a blood sugar disorder. We don't know that yet. Appropriate evaluation will determine that. You can do some neurotransmitter testing, since serotonin is a neurotransmitter. Some people are actually doing urine neurotransmitter testing. I'm not totally sold on that that's an accurate test yet. So we use symptom surveys to evaluate neurotransmitter function to see if that could be a problem. Plus, we do more comprehensive thyroid tests to evaluate if this is a potential problem, as well as a really comprehensive metabolic profile to rule this as a possible problem. So we do enough testing to identify this as the problem, but if you're having thyroid symptoms, you're having some of the symptoms I discussed of somebody who has a low serotonin levels, like anxiety, depression, sleeping problems, symptoms you associate with PMS, and cravings for carbohydrates, then this may be your problem. You're not nuts, you're not crazy, you don't need an antidepressant, although taking the antidepressant may help these symptoms, it's not really fixing the underlying cause. You need to find the underlying cause. So if you're still struggling with symptoms and you think this might be the reason, feel free to get our video or my DVD by filling out the information on the side of this video, and you'll get my complete Natural Thyroid Solutions DVD. Or if you're ready to get started right away, call the office and schedule a discovery visit where we'll take a look at your lab work and some of the testing you've already had done to find out if this is the reason you have thyroid symptoms. All right, take care, and I'll see you on another video.